Hi everyone, Colleen Neal here again with Let's Talk About It. Today I want to talk about the consult that I had with my doctor about my upcoming occipital neuralgia nerve decompression surgery. I am booked to have that done on February 4th of 2025. And I recently had an appointment with my doctor, and I wanted to talk to you about the conversation that I had with him and what I learned about um, you know, the procedure. Again, I'm not a doctor. This is just my experience as a patient. So those of you considering it, this is my conversation with my doctor. Your doctor might have, different ways that they're doing it, but this is what my doctor is doing and the conversation that he and I had together. Again, I got occipital neuralgia. I was diagnosed after a car accident. Um, I deal with this every single day. I have really a lot of considerable pain in the back of my head. I have occipital neuralgia bilaterally. It's been really, really rough. I have a nerve block. I've had a nerve block. I have a video about that as well. It was, I think, for the most part, pretty successful. I didn't really get to the top of my head, but it did offer me relief for about 2 weeks, 2.5 weeks. And because it was successful, the concept is that this procedure should be successful. I did have the option to keep getting nerve blocks, but to me, 2.5 weeks, 2 weeks of, to me, that's, I don't know, it's kind of a waste of time. I want a more permanent solution. I've had a lot of surgeries. I've had a lot of medical things. So for me, um, it's not my first rodeo. I'm not worried about surgeries. I don't have anxiety about surgeries. I want to just get this done and move forward. I also have vestibular migraine, which is really the bigger issue for me. Um, so this is part of the fix, but really the vestibular migraines, really the bigger issue. So anyway, let me actually I'm gonna share with you a photograph that the doctor shared with me that he used to help explain the anatomy and the procedure. So let's put that up on the screen here. Okay. So for my procedure, the doctor's actually going to be, sorry, he's going to be working on actually both the greater and the lesser occipital nerves. So this is the greater occipital nerve here. I'm sorry, you can, I have lovebirds. You can probably hear them walking over there. They're very happy. Here's the greater occipital nerve, and the lesser you would see, over here by the ear. And what you can see here is that this nerve, it goes down several layers of muscle. So the doctor, oh, and again, just to be clear, these nerves, it's not in your brain. So these are under your skin and above your skull. But there are several layers of muscle there that the doctor has to, you know, get under the skin, find the nerve, and kind of follow it through, in through these muscles, and kind of deal with, find it and deal with it there. There could be some, vasculature, wrapped around it. So, is it delicate? Yes, it is a delicate surgery. Um, this is something I feel very confident. This is what my doctors do. They've done a lot of these, and I feel very confident in what they do. So I think this is a really good picture. Obviously, these nerves do, go down to the neck area. What he told me procedure wise, what my doctor does, and again, doctors do this a little differently, and you can Google nerve decompression surgery on YouTube as well. Or, I'm sorry, you can look it up on YouTube as well. I see some that do vertical incisions and some do horizontal incisions. My doctor told me very clearly that they will shave my head probably up to like the mid part of my ears here, which is fine because, I have long hair and it'll cover the rest. I'll have a cool haircut for a while, I guess. And then they will cut horizontally, not quite ear to ear, but pretty close, so that they can access the four nerves. So, like I said, there'll be a nerve here. There's one, the lesser, the greater, that's number two, greater number three, and then the lesser is number four. Um, so let me stop sharing. Okay. So again, I just want to go through some of the questions that I have with the doctor and what he told me. Okay. So I did ask which nerves. He said the greater and lesser on both sides. And what he intends to do is create a groove. Well, first he's going to locate the nerves, of course, lift them, and then get rid of, sometimes they could be tangled with some, arteries or things like that. And they actually, might be tangled. So they remove those, cauterize them, and then they actually wrap the nerves. And I'm not sure what, some kind of tissue. They wrap the nerves so that there's not like scar tissue that's going to adhere to it. And listen, I've had a lot of surgeries, and scar tissue's like not good. You don't want that. I always think of like Spider-Man webs, like Venom's webs. After a surgery, that stuff gets really sticky, and it can get hard, and you don't want that around, because then your nerves later on, they're not going to be able to move, and you want your nerves to be able to glide and your muscles to be able to move around. So once the scar tissue adheres, it's gonna become very gummy and not move around. So I didn't know that about this surgery. So they actually wrap the nerves, and then what they do is they create like a trench for that nerve, decompress, right? So compression is, it's all the nerves are tight within these muscles, and that's what's creating they're, what's the word, they're inflamed and they're tight, so they're not moving. So I know right now, like, for me to move my head this way, like over here, I'm getting a lot of pain. And a lot of times the doctor will say, move your head to the right and look up, and that's like super painful for me. So if you do that and you feel that pain, like you get it. So the idea is to decompress the nerve so that you can have that movement and not have that pain, and your nerves, they have more room to breathe. So that's what they're going to do. I asked, how long is the procedure? He said, for my procedure, it's going to be about 4 hours. Of course, it's done under general anesthesia. I asked where it's going to be done. It will be done in a surgical center. Um, and it is an outpatient procedure, which, I know a lot of people are like, oh my gosh, it's outpatient. I've had back surgery, it's outpatient. I've had rotator cuff surgery, it's outpatient. I've had a lot of surgeries. It's not unusual to have outpatient surgery for even some really, big knee surgery, all those things. It's pretty common, unless you have some kind of complication. Those kinds of things are typically outpatient. I'm not concerned about that, and I think that's not really a big deal. He said, let me just look here. I will go home with a drain. I'll have a drain for a few days, which makes sense. There needs to be a place for fluid to escape. You don't want fluid building up, um, behind the skin in your skull for sure. So I'll have a drain for a few days, and they'll teach me about that. I asked, what will my physical limitations be after this surgery and for how long? He basically said for 3 weeks, no heavy lifting, which I'm kind of there now anyway. So, no leaning over to pick things up, which makes sense. He's like, you don't want to be leaning over to have blood rushing to your head or fluid rushing to your head while you're healing, which completely makes sense. Driving will be okay eventually, of course, not when I'm on narcotics, which makes sense anyway. I have to be careful driving anyway because I have vestibular migraine. So I'm going to play that by ear. He actually said I can like take a shower after 48 hours. So of course I'll have to be careful with my drain. And I know there's some hints with that, like, attaching it to a necklace so it doesn't pull and things like that. But I'll be able to wash my hair and bathe and all that kind of stuff within 48 hours, which is amazing. That's awesome. I talked a little bit about, how, how do we know if it's going to be effective? Like, what's that? And I know a lot of people get nervous about it. Is it worth doing something like this? What are the chances that I'm going to, is it going to be effective? I, So my understanding is, the literature says, 80% of people get improvement of 50% of more. So, I think about that, like, if I can get 50% pain relief, that's way worth it for me because it's like a major struggle every day. Just the pain is really, really bad. Um, and then if I, and that's like the worst people get is 50%. Um, and then a lot of people get 90% relief or 100% relief. Like that would be fantastic, right? I mean, that would be fantastic. So that's the hope, of course, right? Um, 3 to 6 months is where you determine the effectiveness. He was saying the first 3 months, the nerves could be numb, right? They're waking. I remember when I had my first back surgery, I had sciatica really bad in my one leg. Um, and I remember it took a long time for my nerve to wake up in my leg. Um, and when I had my back fusion, I remember my left leg, I had trouble walking for a couple months because my nerve was like, kind of, it was kind of hung up on one of my bones there. Um, anyway, so he said it'll take about 3 months, it'll be numb, and then over time, those nerves will start to wake up. And then, when the nerve wakes up and the sensation returns, that's when we start to see, where we're at, what over time, what level of pain will I have? How will it be different than what it was before? Um, Full healing, complete, total 100% healing can take up to a year. So you figure, you know, between 3 to 6 months, 3 to 9 months, that's when we're really going to know like what we're dealing with. So I asked him, I will tell you, I asked him straight up, like, how long am I going to feel like complete crap? Like that's what I want to know. Like, I'm going to come home from this thing, and I've had all kinds of surgeries, and some of them like, oh, like I only feel bad for a day. Some of them like, oh, I feel beat up for a week. He's like, you're going to feel like really crummy for like 4 days. And a lot of that is general anesthesia. You're going to want to sleep just from the general anesthesia and narcotics and stuff. I'm like, all right, I got that. Like 4 days to a week, I'm going to feel crummy. All right, just let me know what I'm dealing with. I'm fine. And then after that, it's just okay. Just don't pick heavy things up, and your head's going to be sore. My head is sore anyway. I don't feel good anyway. So okay, that's fine by me. Um, let's see what else he said. Oh, I asked about physical therapy. He said, some people do physical therapy. It's not for much else except for to prevent to make sure you have flexibility in your neck and to prevent stiffness. So I don't think it's like a major physical therapy protocol. It's just to make sure, you're moving your neck, you're stretching your neck, right? You can still twist, you can still do all of those things, which completely makes sense to me. So that's really where it's at. I'm really excited to get it done. I have to go through the regular course of getting the pre-admission testing done. You can't get that done until 30 days prior to the procedure itself. It's only good for that time period. So I'm waiting for insurance to approve it, which you have to go through all the hoops. You have to have had seen so many doctors and tried so many modalities and do the physical therapy and do the different shots and do the different pain management, do a nerve block or two. You have to do all that stuff before they allow you to do a surgery like this. Um, and then the doctor's office will present that case to insurance, and then insurance has to okay it. And then you go from there. So I'm waiting for insurance to okay it, and then I will set up, and then I'll get the prescriptions to get the pre-surgical testing done. And then I'm ready to get it done on February 4th. I know I'm the first in line on surgery day, and I will take you all with me on that day, pre-surgery, and then when I come out, and then I will take you along as I go through the process. So those of you who are thinking about it, you know, again, this is all individual. How it goes for each person is different. Sometimes when you look online, you only hear the bad stories. So I don't want you to make your decision based on everything you see online. And I don't want to make your decision based on what I go through, because it's different for everybody. So we'll see. All right. Well, that's my experience with my consult with my doctor. And I will see you in the next one. I will be covering other topics about vestibular migraine and my experience with occipital neuralgia too. So everybody have a great day, and I'll see you in the next one. Bye.